May not necessarily agree with it. You know,
Today is Tuesday.
Did it pop up loud?
Yes. You guys ready? All right, so let's get started. Welcome everyone to the panel on crisis aversion and rights retention, or known as CARR. We're going to begin by introducing our panelists. If you want to start this way, then we can work our way down. If you want to just introduce yourself and then also just tell us a little bit about your background.
sure. My name is Whitney Austin, and I'm the executive, I'm the executive director and co-founder of Whitney Strong. That's an organization I founded back in 2018 after I survived a mass shooting that happened in Cincinnati, Ohio. I won't go into all of the play-by-play details, but I do feel it's always important to share that 3 people died on that day, and somehow I was not one of them. I survived 12 bullets, and as a result of that miraculous outcome, I decided, along with my husband, that we needed to start Whitney Strong, an organization that could pull people together to reduce gun violence in our state and in our country. And so for the last almost 4 years, I have been totally professionally committed to reducing gun violence in our state.
Okay. I don't know if you want to. Yeah.
Hello, my name is Morgan McGarvey. I'm an attorney here in town and also a state senator. And how I came into this process is Whitney Austin is my constituent in the state senate. And through a mutual friend, because Louisville's a small place, I literally went over to her house the day she came home from the hospital in Cincinnati after having been shot in the mass shooting, and started dropping files of pieces of legislation around the country, ideas that would work, because she knew she came home from the hospital with a mission. And so we developed this piece of legislation, have gotten bipartisan support in the Senate for it, and are pushing it forward. We've had a hearing on it in the Kentucky State Senate. We'll continue pushing on it next year.
Good afternoon, I'm Judge Stephanie Burke. I am a district court judge here in Louisville. I am the president-elect of the Kentucky District Judges Association. Here in Jefferson County, I'm currently sitting in a criminal court, but for the last 3 years, I have been assigned in the mental health courts. I ironically met Whitney because on the day of the shooting that she was victim of, her uncle was a doctor witness in my court at the time that he learned of what had happened, and subsequently he introduced us, and she knew about my role as the legislative chair of our District Judges Association, and asked me to be involved with her on her journey to get this legislation through the legislature. And so as over the last 4 years, we have worked with her and collaborated with her in giving her input on how to best tailor the legislation for passage, and we have got to be really good friends as well.
Thanks. I'm Dr. Eric Russ. I'm the executive director of the Kentucky Psychological Association and a clinical psychologist in town. This came to us through our legislative process in KPA and the Psychological Association, and it just became a really exciting bill to work on to help keep Kentuckians safe and protect us managing suicidal and homicidal thoughts.
Okay. So I am Natalia Martinez. I'm the investigative reporter for Wave Reuse. My bag of Skittles is covering corruption, unfortunately a lot of violent crime, and lots and lots of law enforcement matters at the center of so much of what I've done. Unfortunately, is the discussion about guns and who is able to get some in their hands, and I think this is part of what we are discussing today. So Whitney, if you would like to just lay the groundwork, explain what CARR is, and then we can start from there.
Here. So Senator Garvey is right. I'll never forget coming home from the hospital. I had just had my hair washed multiple times because it was still full of blood. And once that had been completed, I was laying in the bed and here comes Senator Garvey. And I'm sure, he's very much deer in headlights as to what he was looking at. But I also remember him leaving me with many, many pieces of paperwork. These are all of the different policies that I'm aware of that are effective at reducing gun violence. You do your research and you figure out, which one stands out to you, what you think you could make a difference with, and then I'll be here to support you. And so I took that responsibility very seriously, not only from reviewing these from an efficacy standpoint. I knew that it was going to be a difficult path, and I wanted to make sure that the legislation would actually work. And then speaking to that difficult path, I really wanted a piece of legislation that could garner bipartisan support. Personally, that's important to me, to see both sides of an issue. And then secondly, strategically, it seemed important considering the makeup of our legislature. And so, that was late 2018, which is a different political environment than, halfway through 2022. But at the time, there was a real bipartisan groundswell of support for a policy called extreme risk protection orders. And so number one, that really interested me. Look, senators from both sides of the political aisle in DC are endorsing this particular policy. And also a report had been released from the White House, the School Safety Commission report, and in it, President Trump had endorsed extreme risk protection orders as a policy to reduce violence. And so I started to think, all right, yeah, this seems like a good solution that we should pursue. The last part of this that's important to include is it had such a personal connection to me. I think back to what happened on September 6, 2018. And not only the frustration initially as to what happened to me and how much my life changed as a result of the injuries that I took on September 6th, but also even more frustration about the innocent loss of life that happened on that day. And gosh, if there really was something that could prevent this from happening to other people, whether it's people walking into their corporate environments or people walking into their schools, I need to be on the side of that. And so I really started to go, head first into extreme risk protection orders. And so this is probably a good time to help you understand what extreme risk protection orders are and really how us starting with extreme risk protection orders evolved into crisis aversion and rights retention, which we believe is a custom policy that has been created for Kentucky. And so really both policies are similar in that they're serving the same purpose. You have someone who is approaching a crisis moment, whether that person is approaching a crisis moment to hurt themselves in terms of suicide, or they're approaching a crisis moment to harm others, like what happened to me in an incident of mass violence. And just this major gap that exists in our gun laws across the country that we can't do anything. We cannot do anything to intervene in these moments. And shouldn't we have a policy that allows us to do so in a very responsible way? And so that's what extreme risk protection orders are all about. You have someone who's approaching a crisis moment. You have good evidence to support this. This is not just people making things up. You have good evidence to support this, and you take this information to local law enforcement. That's really the first filter in the process. Law enforcement is traditionally in a place to assess risk, to determine if the information and the evidence needs to move forward. And if law enforcement deems that it should, then it moves from law enforcement into the district court and the district court judge, who at that point is tasked with the second filter, right? Making sure that a certain level burden of proof is met to determine yep, we've got the evidence we need, this person is truly at imminent risk of harming self or others, and we need to intervene. And if that burden of proof has been met, then the order is issued, the CARR order is issued, and then law enforcement is tasked with serving the order and helping that respondent see their firearm temporarily transferred. I'm gonna keep kind of going down the timeline. At that point, the firearm has been temporarily transferred, and no more than 2 weeks, that respondent is going to have the opportunity for their evidentiary hearing. Maybe they have more evidence that they want to present as to why they disagree with this order that has been issued. They have the opportunity for representation. And so in that hearing, we're now determining via the judge as to whether that order should be extended. And if it's extended, it could be extended up to a period of 1 year. And so this is now a higher burden of proof level that needs to be met. Let's assume that the level has been met, and this person has seen this order extended and issued for a period of 1 year. One other thing that I want to highlight in this period is there are kind of off ramps and on ramps. If the respondent is taking steps to get back to a place in which they're now a more responsible gun owner, they can be reunited with their firearm, they can petition for another hearing. I have more evidence that I would like to present to you. And the other thing that's important in this period of time is getting them help. You know, we hear a lot of feedback from, you know, the lawmakers that we have consulted with to just everyday civilians that if you remove the firearm temporarily, there's still a reason that that person was approaching a crisis moment, whether it is a divorce situation, a loss of a job, anger management, mental health. You know, there are many reasons that come together to get someone into a crisis moment. We need to provide them help. And so there is a huge emphasis with CARR that we will provide encouragement and access to services so that the person can get back to a place in which gun ownership is safe, and ideally by the time the order expires. I've probably taken a lot of time to answer that question.
That is a perfect jumping off point, because I wanted to start with Dr. Russ. And let's just start from the very beginning. We just heard Whitney say the term crisis moment. There's a lot of talk about mental health currently, especially during the pandemic. So can you explain to us what is a crisis moment, and then what are the similarities between a crisis moment and somebody who may be experiencing mental health issues, and the differences, right, between having a crisis moment and actually being diagnosed with a mental disorder?
Yeah, this is a complicated question, and I'll first say that I know that a number of people in the legal community have died by suicide over the last year. So I'm going to be talking a little bit about factors that contribute to that. I did just from the outset want to offer you a consultation from the Kentucky Psych Association. If organizations or individuals need help or want to reach out, we're here for that. To the question about mental health and violence, it's an easy answer to a complicated question. A lot of times we want to have an explanation for things that we don't understand. So something really terrible, like a mass shooting happens, it's really easy to say, oh, that person must be crazy. That's not like me or anyone I know. This is some aberrant event. And what we know is that mental illness is not a very good predictor of violence. That the kinds of things that lead people to commit violence are behaviors. And there are really a couple of things that we want to look at. So when we look at something like suicide, and we'll talk a little bit about how that impacts with violence as well. When you look at people who are attempting or ultimately completing suicide, you're looking at the desire to die and the ability to do so. So you need people to have both that desire and ability, and that's who we're concerned about. And the same thing is true on violence. Right? You have to have that desire, and that's something that's sort of hard to assess, hard to change, but isn't really connected to a diagnosable mental disorder. The other piece of the equation is the ability, and that's what we're talking about here in our ability to address. So if you look at suicidality, people tend to think about it a lot. This is why we assess for things like suicidal ideation. You've been thinking about suicide. Have you taken any steps to collect weapons? Are you thinking about how to do it? And the same thing we see on the violence side is that people do lots of preparatory behaviors. a lot of these mass shooters are planning these things months, a year ahead of time. And there's evidence of that in social media posts and their conversations with their friends and family. A lot of times after the fact, you'll find interviews with people in their circles and they'll say, yeah, I was a little worried, or, the person started acting kind of strange or talking to, people online in more violent kinds of communities. Those are the warning signs where we need to look for. And those are the warning signs that law enforcement is really good at discovering, assessing, and evaluating. And that's part of why we need these CARR reports.
So if this goes before the district court judge, how would you describe the person's state of mind who the judge is deciding whether this may be, and does the judge consider, is this a mental illness or is this a person who was having one of those crisis moments? How would you describe that and help the judge understand what the difference between those are?
Absolutely. A crisis moment is really something where there's a change in the usual, behavior of the person. So the balance between our thinking and feeling is off. And we've all had moments like this. Something happens in our life where we act in a way that we wouldn't describe as us. Something terrible happens, you have some kind of traumatic event, or somebody makes you really angry. You can think of those moments of road rage. Maybe you're not like an angry person, but somebody cuts you off and you're screaming at them or swearing at them, something like that. And your usual coping mechanisms fail. So we can think about those moments are harder for us to tolerate when we're not sleeping well, when we're disconnected from our friends and family, when we're isolated, when we're feeling lonely, when our resources are low, our psychological resources. That's when those moments tend to happen. And they tend to be transitory, right? So something happens, you may feel a little out of sorts, and it gets better. And you can think of an extreme version of this, right? Where you're totally, sleep deprived, you're out of resources, you don't know how to cope, you don't know how to handle this. That's those moments of crisis that we're really looking for, versus a long-standing pattern of mental illness that tends to be cyclical, tends to wax and wane, and needs different sorts of interventions.
Do you think that because of how the media portrays some of these issues, that it may make it more difficult for the mental illness, stereotype to be?
Yeah, absolutely. I think that
You can be honest.
no, I think it's a problem. I actually think it's gotten better over the last 2 or 3 years. Unfortunately, a lot of these incidents have happened, and we've seen some improvement in the way that the media covers events. But I still think there's a tendency to jump quickly to, is there a history of mental health contact ever? Does this person have some particular disorder or not? And what we know is that people with mental illness are much more likely to be a victim of violence than to perpetrate violence. And again, mental health diagnosis in general isn't a very good predictor of these things. So if we're trying to stop these, get ahead of these violent incidents, mental health is not the way to do it.
Okay, so I want to transition to Judge Stephanie Burke. So now there's an individual who may be presented in front of your court where there's concern about their safety, the safety of others, given their access to a firearm. So what are some of the key things that you would consider when making that decision? And would the person reporting that, the petitioner, how much the proximity of the closeness to the person that they're presenting, would you consider that? What are some of the things that you would take a look at?
Well, I think one of the most important things is you would want to be concerned with what is the actual threat. Are they verbalizing threats? Are they verbalizing threats to themselves, to others?
Just hold the mic, just
If from doing mental inquest warrants, which are around individuals who are mentally ill, we're looking for danger and to themselves or others. And in this situation, we'd be looking for pretty much the same standard, except we wouldn't have to be looking for that diagnosis of a mental illness, which we are looking for in a criteria for a mental inquest warrant, which is for hospitalization, involuntary commitments. Here, we would be looking for the behaviors that are unusual, escalating behaviors, aggressive behaviors, for actual threats, things that would make you tend to believe that the person is acting out of normal character. And then you would be looking at who is the petitioner? Is it someone who is in close proximity to the individual? What's the duration of time from the threats? Is this something that was imminent? Is this happened, yesterday, last night, today? For examples, when we're reviewing requests for emergency protective orders or domestic violence orders, we will sometimes have individuals. I'm on call today, and so I've been reviewing domestic violence orders. And for example, I reviewed one in the last 24 hours that the individual said that the person was sending text messages and calling them names and making threats in March of 2020. And that's not an imminent threat. Clearly, that's not something that I need to do something imminent today, and it doesn't rise to the level of something that needs court intervention today. So you really have to look closely and see what is the person's real impetus and motive. Because sometimes persons will bring actions against others that are not pure motives, but are, sometimes not what they should be. So you have to look at the motive behind it.
So a couple of follow-up questions, especially because we're at the Bar Association for all our attorney friends here. Would this at certain points cross over into the criminal realm? And could it be used potentially by attorneys to argue on behalf of somebody who may be facing a terroristic threatening charge or something like that?
I think that individuals could take either action. I mean, I think that with individuals exhibiting this type of behavior, there's lots of paths that someone could follow. They could take a mental inquest warrant for an involuntary commitment. They could also take a criminal complaint. They could also take out a domestic violence order. They could also take out an emergency, crisis aversion petition. So it's really going to be, what does that individual choose? And I think there's, based upon motive, I think in a situation like this, you would probably have someone who cares very much about the person, is very concerned about their safety and other safety. It's not so much unlike those other actions, it's not adversarial. Domestic violence, that's pretty adversarial. And someone who's seeking an emergency protective order, that's something that's adversarial. Now, in a petition for an involuntary commitment, that's not typically adversarial either. That's somebody seeking protection to get someone hospitalized because they need care. But you really have to look at the motive.
Okay, so another question, if you could tell us, we've covered so much of the current state of our courthouses, the current state of our jails being overcrowded, lots of burden, lots of workload. How realistic would Jefferson County's courthouse, for example, be able to implement CARR and efficiently use it, given the amount of cases that we're seeing?
Well, currently, I mean, in the last, in recent years, we have had a number of new causes of action added to our books, basically. Casey's Law increasing with the addition of Tim's Law, which is assisted outpatient treatment. So the courts no longer just have the ability to order someone into an involuntary commitment, but we can now order them into an outpatient commitment for supervision. And so this would just be another tool in the toolbox. And so the courts would obviously accommodate that, and we have the ability to accommodate that. It would be something that would be heard. We believe there should be concurrent jurisdiction between the district and the family courts, not just the district courts. Just like with emergency protective orders and domestic violence orders, because that, to us, that makes more sense. And because it does spill over into the domestic relations realm. So we would like to see that change in the current bill and have it be concurrent jurisdiction between the family courts and the district courts. And so in other counties, particularly rural counties, where you don't have as many judges, and you don't have access as frequently, here we have, 17 district court judges and we have, 10 family court judges. It's not like that out in the state where you have one of each. So it would be better to those rural counties to be able to let them both do it. So you would have more access to a judge. So we think that would be a change that would benefit the public to have more, better access to judges 24/7.
Would anything need to change currently in order to allow for CARR to be efficiently implemented through the court system?
Well, obviously, if the law was enacted, there would be some things that would have to change. First, there would be some legwork behind the scenes. The courts would have to implement the forms. You would have to be creation of the forms for people to fill out. So the process itself would have to be created from within the clerk's office. So where the person comes into the courthouse, the clerk's office would have to have like the paperwork that the person fills out. They would have to know the process. They would have to know the procedure, how that goes to the judge. On the part of law enforcement, there would have to be a lot of training. They would have to know their responsibility. There would be cost involved, particularly we foresee this would be the sheriff's, just like an emergency protective order situation. So, there's lots of moving parts here. And so every one of those parts would have to know their role and be prepared to take on their role. So there would definitely be, some window there of preparing. And that would be the same as when Temsot was passed. It took some months and still, it was originally passed in 2017, it was amended in 2019, it was amended again this year. And I think it is in a really good state where we're actually doing it here in this county, in Hardin County. And it's going to take us some time to, expand across the state, but like anything, it does take some time.
Okay, so I'd like to transition to Senator McGarvey, because we are talking about gun control. We are talking about it in a state such as Kentucky, where there's very limited laws that actually apply to a person's right to possess a firearm. So what challenges do you see in passing this legislation? Give us the temperature of our current political climate to make something like this be able to pass.
And this is one thing I think we've worked really hard on, is making sure that we are getting input. This is not new. Kentucky's not going to be the first state to do this. Kentucky's not going to be the first state that has a more conservative legislature to do this. Indiana, our neighbor, has a law similar to this on the books and has had it for 18 years now. So we know this is effective. We know this can be passed in more conservative states. And we've worked really hard to make this, to take the best examples from different states and then tailor it to Kentucky to make sure it works here. And what we're finding is you're finding some common ground. We talk about gun violence in Kentucky, and we should. But what we don't talk about often enough is 60% of the gun deaths in Kentucky, more than 60% of the gun deaths in Kentucky, come from death by suicide. That number is even higher as a percentage for veterans. That's something that people in Kentucky and across Kentucky understand. That's a person in crisis. That's a person who is an immediate threat to themselves. And we know from talking with mental health professionals, from talking with lawyers, judges, community members, veterans groups, that just that temporary separation, as Dr. Russ said, you have to have the desire and the ability. If you can delay that ability to do it, even just a little bit, then maybe somebody gets the help they need or they deserve, which is what Whitney was talking about, getting people help in that intervening period. That's what has attracted this bill to always be a bipartisan bill, and not just Democrat, Republican, but urban and rural. I think that's a divide we don't talk about enough in Kentucky, is the urban-rural divide. And bringing people together to see that this is a challenge that every community faces, and that there is something we can do about it. And so this law, I think, does a really good job of balancing what is practical, what is possible, with the current political climate in Kentucky.
So let's talk about constitutionality, and how this law stands up to it. How would you articulate how this law does not impede a person's right to bear arms?
Yeah, first and foremost, I mentioned we're not the first state to do this. Was it 17 states?
More than 19.
19 states have done it. 19 states have a law similar to this on the books. I believe almost all, if not all, have been challenged. None of those challenges have been successful.
What is
So-
it about the language in the actual legislation that kind of stops that argument when constitutionality is?
Yeah, and so let's talk again about what the legislation does. When the Supreme Court talks about the right to due process, they're talking about a meaningful time, a meaningful manner in which to be heard. This bill doesn't. Not only, in fact, this bill does it, I think, in a more clear way than bills from other states. Number one, only a law enforcement official can file a petition with the court. There's an investigatory process that happens from an officer of the court at the very outset. Other states allow family members or relatives or people close to an individual to file these petitions in the court. That's not what this bill does. So that's step number one. Step number two, then a judge reviews that petition, and there are certain questions you heard Judge Burke talking about what judges do in this process. Then, of course, it is temporary. If an crisis aversion rights retention order is granted, it is a temporary removal from an individual who is a danger to themselves or others, and they're going to get a hearing per the statute within 14 days. Not only do they get a hearing within 14 days, if we take a step that I don't think a lot of states do, which is we actually give the respondent the right to counsel. So drawing not just from situations similar to what you see in emergency protection orders and domestic violence orders, but then also taking that idea of right to counsel and giving it to a respondent. There's another safeguard in there. And that is, if there is a meaningful change in circumstances, then at any time, a respondent can file something with the court. So let's say that there is somebody out there who is entertaining suicidal thoughts and is a danger to themselves. They are removed from their firearm, they get help, and that help could be anything. That help could be they were going through a tough period in their life, they lost their job, they're going through a divorce, they could suffer from some type of addiction, whether it's alcoholism, whatever the circumstances that led them to be in that state where they had both the desire and the ability to take their own life. There can be changes in circumstances. And those changes in circumstances, they can come back, they can present to the court, and then the court can hold another hearing determining whether they are still a danger to themselves or to others. And so I think there's multiple safeguards in this bill for the current constitutional rights as outlined by the Supreme Court.
Is there one particular piece in the bill or one particular piece of language that you have to, that you would be arguing mostly in favor of? So is there anything particular that's kind of stopping the bill for those that may not be supportive of it?
Well, I think this is where you have to talk about politics. You go from talking about law and policy to talking about politics. For instance, we knew this year we didn't have a great opportunity for this bill to pass. It's an election year and a year where there was redistricting. And so this was not a great year, I think, to introduce ideas that haven't come up for a vote previously. Next year, my guess is the 30-day session will be all about the governor's race. And so we'll keep pushing next year, and hopefully we'll have to find some new sponsors for it. And I know Senator Hornback won't be there, he's been carrying it in the past. But this is a bill that continues to gain support with anybody who sits down and actually reads the legislation and what is there, instead of not reading the legislation and believing what is there. And so this is when law enforcement is coming out in favor of this bill. You're building those coalitions again with urban, rural, Democrat, and Republican legislators. And I think there's a lot of very different groups out there who are saying, this is a good and useful tool to keep people safe and our community safe.
So Whitney, on that note, do you believe, had this law been in effect when your incident happened, do you believe that it would have helped stop the shooting?
So it's hard to say specifically with my incident because unfortunately, I think there was a lack of investigation that really went along with my shooting. But what we do know, and Dr. Russ talks about this quite a bit, and I always go back to this book I love, I brought it for anybody that wants to read it. It's called The Violence Project, How to Stop the Mass Shooting Epidemic. And it was funded by the government. 2 researchers went back and looked into mass shooters back to the late 60s, and they studied over 170 mass shooters. And one of the things that stood out most to me in this book in researching mass shooters is that 65% of mass shooters show leakage. They leak their plans. And so whether it was my shooter leaking his plans and we were not aware because there wasn't enough investigation into it, or the many other incidents of mass shooting, we see this leakage. In fact, I would encourage all of you, as more mass shootings sadly erupt across our country, just pay attention to how many times you read about the fact that someone knew or that multiple people knew. And so when I think about CARR, I think about it in 2 ways. Not only do we have a responsibility to pass this legislation and make sure we have a tool to intervene, but we also have a responsibility to educate civilians. What are those warning signs and what are the steps that you need to take when you come across someone who is approaching a crisis? And if you know, and you also have CARR, we can prevent these situations from happening. And don't forget about suicide as well. There are absolutely warning signs with suicidal people, and we should be able to intervene and get them help too.
Sadly, I want.
Yeah, just one, if you all remember several years ago in Texas, there was a mass shooting, I believe it was at a Walmart. And it was in El Paso, and was it the shooter's mother or aunt, or someone had called the local sheriffs and said, I am worried. I believe he is going to do this. And the response from law enforcement is, we're sorry, at this point, there's nothing we can do. So when Whitney talks about this as a tool, that's what we're talking about.
Can we talk about how this would also, and unfortunately, we see it far too often, and that's young people engaging in mass shootings. So many of our schools have been affected. How do you think this piece of legislation may intervene and help when we're talking about young people, juveniles?
So I think what's good about this law is we've been refining it, we've been working with prosecutors, defense attorneys, judges, mental health professionals. We already have one change to make today, thanks to Judge Berg as we go forward. But what's nice about the bill is how it applies, I think, uniformly to people who are in crisis. And as Whitney discussed, when you're talking about mass shootings, oftentimes there is someone who comes forward after the fact and said, we thought this could be a problem. And I think this particular piece of legislation could help, I'm not saying it will help every time, but could help any individual who is in that type of crisis where they're considering taking on that mass scale violence, regardless of their age.
So I have a question for Judge Berg. For someone who may be considering, for someone who may be worried that I'm going to end up going to jail if or my loved one may end up going to jail if I report them, or if I say that, there's a danger. What would you say to someone who may be considering that and that may be impeding them from using this tool if it were available to them?
Well, this is a civil proceeding, as are most of the actions which involve mental health. Both the civil commitment process, which is MIW, Thames law, Casey's law, and this proceeding are all civil. So with all of those, they are seeking some type of treatment, some type of help, and hospitalization here is taking the gun to protect the person. So it's not it's not a jailable offense. And so I would encourage people to utilize those processes more, as opposed to taking out criminal complaints. I mean, one of our biggest burdens on the criminal side is that we have so many individuals charged with criminal offenses, sitting in custody, waiting competency evaluations because their actions were a result of their mental illness. And the criminal justice system is not equipped to deal with persons whose behaviors are driven by their mental illness. We have to treat those individuals differently and more humanely. And the criminal justice system is not equipped to do that. And so you cannot incarcerate the problem. That is not it is not a solution, and it actually makes them worse. It makes individuals who are sick worse because they are a bigger burden on the penal system. If you put individuals in custody, they become a bigger burden than other individuals because they're much more difficult to supervise. They oftentimes get put in solitary. It's much more expensive, and they end up becoming sicker. So then they get out, and it's just a vicious cycle. So we have to break that cycle. And this is a way to try to avoid those more dangerous behaviors any way we can do that. And that is one of the reasons the changes to pushing AOT in Tips Law is trying to help manage people in the community, keep them well in the community with compelling outpatient care, and trying to keep people medicated and on their medication and getting the services they need. And here, you're trying to protect the person. I mean, when somebody like this comes to ends up in the court proceeding, and it comes to the attention of the court, the prosecutor's going to be involved in this proceeding. There's going to be appointment of counsel in this proceeding. There's going to be a judge involved. There's going to be a flow over to where that help needs to come from. Whether it is this person needs hospitalization, this person needs outpatient care, this person needs referred to 7 counties, but this is going to get somebody in front of a court where we know where the services are. So they're not just going to get their gun taken away, which is the most critical thing, but they're also going to be at a place where they can get like traffic copped to the right place, and the family will get, the opportunity to be told, meaningful information. And that is what more people need than anything is information.
Can we talk about resources? Is this a challenge to get, there's so many moving parts, right? There's the judicial system, then there's law enforcement, and there's education in the public. How difficult would it be to get all of those components up and running in order for CARR to be quickly used effectively?
I think we're talking about the interaction of lots of systems that we're all working to make better, right? These are all systems that we know have their own challenges, the legal system, the mental health system, the education system. But I thought Judge Burke's point about this is a place to get people on the right channel to access those resources is really critical. When we talk about rights, the alternative to this is involuntary hospitalization. And this really allows people to avoid that, to have the danger taken away, have the weapons taken away, which is that critical step, and to figure out what the person needs. Sometimes that might be a mental health intervention, but oftentimes it might not be. It might be that there's a housing issue. It might be that there's an isolation issue. If you think about kids and young people, your question earlier, there's a lot of social disconnection, a lack of belongingness, difficulty developing identity that we've all seen worsen in lots of online communities where that can turn into anger, rage, these sorts of things that drive this behavior. A CARR bill would allow us to catch that behavior early on before it develops and wrap around that individual in a way that gets them back on track and keeps them out of criminal system, hopefully keeps them out of more intensive mental health needs, and gets them connected with those services. Sure, that there are issues with that, but I think having someone connected with a court and a judge who can help direct them in the right direction certainly gives somebody the best chance for success.
How much progress do you see have you seen in the last, say, 5 years, in the last 10 years, and even in the last couple of years since the pandemic hit, when we're talking about the implications of mental illness and the effect that the pandemic had on so many people, suicides? Do you see progress, and where do you see this law? If you close your eyes, where do you see it in 5 years from now?
Yeah, I think that's a big question. One of the things that I think about is we had a mental health crisis before the pandemic. So there's a lot that's been written about, particularly a youth mental health crisis that existed before the pandemic, and it's sort of changed in nature, and the kinds of things that we're seeing have evolved as the pandemic has affected our lives in lots of different ways. But that hasn't gone away, it's just been growing. I think this bill helps get more kids, more people into to whatever services they need. Some of that's going to be mental health, but again, some of that's going to be other things. I actually have a lot of hope that this kind of bill gets people into the right kind of services that they need, including mental health services. There's a lot we can do for folks in these conditions, whether or not they have a diagnosable mental health condition. We know a lot about behavior, about how to help folks, but what we really need is that means restriction. The single best thing, the single best intervention we have to prevent suicide is means restriction. So that means taking away the capacity to, or the ability to complete that suicide. Most of the time that's a weapon. So if you look at a system like the VA tries to get gun locks to every veteran that has a gun. Because if you have just that few minutes it takes to get your gun lock off your gun, it's a little more time you have to think to reconsider what you're about to do. This provides a legal avenue to do that, to have that means restriction and avoid the bad outcomes that we're all looking for.
Are there any questions? Okay, so have discussions already been had with, say, LNP, with the largest police department in the state, JCPS? What is their take on this so far? Are they supportive, and how willing are they to work towards implementing a tool such as this?
And I'll let Whitney answer as well. I will admit, I have not spoken with the current chief of Louisville Metro. We've been through a few in the last couple of years. But the previous chiefs have been supportive of this since we introduced it, and we have certainly met with LMPD over the years on this, and they've been supportive.
Yeah, and I'll add that we continue to work to bring in more factions of law enforcement for endorsement. We were able to pull in nearly 20 endorsements this year during session, and that organizations ranging from mental health to social services to child welfare. And so really one of the missing pieces is law enforcement. And so we'll be working on that over the summer.
Judge?
I'm on the board of the Louisville Metro Police Department's crisis intervention teams. They have a board, and I can say that they're very progressive. And so I think this is something that they would be, they would welcome another tool in the toolbox. I mean, it's just another tool, and I think that they would be very open to it. From that perspective, haven't spoken with the chief, but I believe that the team who deals with this population would be very amenable to seeing this be a tool that they could utilize.
Any final thoughts? Do you have any questions? Or is there something that I didn't ask?
So some of you may be asking, what can you do to help? And I'm glad that that's what you're asking, because this takes a movement and a coalition, and it is much broader than the 4 people here in this panel. But you can join us too. And so as we are not in session currently, the most powerful thing that can be done right now is to simply add your signature of support to our petition. And if you go to whitneystrong.org, you will see in the navigation panel CARR, And that's where you can go to add your signature. It's very simple. And if you'd like to get involved further than a simple signature, you can also reach out to me via the website. And I'm happy to share more about our tactics, what we'll be doing over the summer to build the coalition. And then we'll head into session again, starting in January. And I want to say thank you to the panelists because we really have a good bill because of their expertise and their willingness to sacrifice their very valuable time. So thank you all. You've all played a significant role in this.
All right, well, I think if there's any other final thoughts, thank you so much for joining us. And the website is?
It's whitneystrong.org.
Okay, well, thank you so much.